A third person has died in a Listeria outbreak connected to plant-based milks. Chris Glover joins us now with more on this. And Chris, all the deaths have been here in Ontario, even though this outbreak is countrywide.
Yeah, absolutely. It seems to be affecting Ontario particularly hard. And now we know that 2 of the deaths are from here in Toronto, and a third was announced last month, being from Peel. But as you mentioned, of the 20 lab-confirmed cases by the Public Health Agency of Canada, more than half of them are from here in Ontario, 13 of them from Ontario. And we know that 15 of those people had to be hospitalized. We also know that the cases range in age from just 7 years old all the way up to 89 years old. And we know that 70% of the 20 cases from across the country are 50 years of age or older. We also know that 65% of the cases are women. And the Public Health Agency of Canada says that people started becoming ill with this back in August of last year, and some of the cases were confirmed as recently as mid-July of this year. And on July 8th, we know that Danone Canada and the Canadian Food Inspection Agency issued a voluntary recall of 15 Silk products, plant-based beverage products, and a recall was put in place not to consume, sell, serve, or distribute these products. And people should still be checking, Dwight, because really interestingly, with this recall, we know that some of the best before dates are up to and including October 4th. And this is something that people should be taking very seriously, according to infectious disease expert Dr. Isaac Bogosh. Here's more from him.
If you have any of these products, throw them out. If you're not sure if you have these products, throw them out. Better safe than sorry. The incubation period can be as short as 7 days, but can also extend for weeks and weeks. And that's a period of time where you might have ingested the bacteria unintentionally. You haven't developed symptoms yet, and that's the period of time between ingesting this and developing symptoms. Now, the real risk, the most severe risk, is in people who are on the extremes of age, the oldest among us, the youngest among us, also in pregnant women, and in people who are immunocompromised. Those are individuals who are at risk for very severe infections. The bacteria can get into the intestines, it gets absorbed, it gets into the bloodstream, and then it has a predilection for going to the brain and causing a pretty severe meningitis. Most people who are not, in the extremes of age or pregnant or immunocompromised, they'll have a diarrhea-like symptom, they'll have gastroenteritis, mild to moderate, usually it self-resolves, but certainly this can cause more severe infection in those with risk factors. We see it occasionally in the hospital. We can treat it, we can diagnose it, but the key thing here is to prevent it.
Now, last week, the Canadian Food Inspection Agency confirmed that the Listeria contamination originated at a beverage production facility in Pickering, Ontario. We know that investigation is still listed as active or ongoing. And we've also reached out to Danone Canada because they use that production line. And in previous statements, they have said that they found it devastating to learn of these deaths, and they offered their sympathies to those who were involved. They also said that they've initiated this recall, and they've also halted production and any of the products coming from that facility in Pickering, Ontario. Public Health advises that you should still be checking for those products. As Bogosh was mentioning, they are quite serious, especially for immunocompromised people. And even if people are hearing about this and thinking, oh, they've kept it in the fridge, it should be safe. It's not perhaps like deli meats, for example. Dr. Isaac Bogosh says, think again. Watch this.
The interesting thing about this particular bacteria, Listeria, when people think, well, I have this product, I'm keeping it in the fridge, surely this bacteria isn't going to cause problems. If it's in the fridge, it's not going to replicate. But that's actually not true for this particular bacteria. Listeria is known to survive and multiply in refrigeration temperatures. It's sort of unique to this particular bacteria. So it certainly can cause problems, even if the product is stored in the fridge where it should be stored.
Okay, so if you have had any of these products, watch for symptoms. They could show up as early as 3 days after contaminated food has been consumed. Some of those symptoms you should be watching for are fever, nausea, cramps, diarrhea, and vomiting. Some of the more severe symptoms, as Bogosh was saying earlier, can actually take up to 70 days for them to present in the body. And some of those that people should be watching for are stiff neck, confusion, loss of balance. And if you've been diagnosed with this, even if you're symptoms don't feel that severe, public health says do not cook food for anybody else. So just some of the things that people need to keep in mind as they hear about this outbreak, that now we know there has been a third confirmed death linked to this outbreak. Dwight?
Important information. Thank you, Chris.